The following segment discusses nasal reshaping, commonly called rhinoplasty.
Rhinoplasty, which is really a procedure to reshape the nose, is a very commonly performed surgical procedure today. With proper execution in appropriately selected patients, it can provide a welcome change in the outer appearance of the nose. It is often combined with maneuvers inside the nose as well, which can improve breathing in those with difficulty breathing due to structural problems within the nose.
These are before and after photos of a patient who had a rhinoplasty. He is happy that his nose is straighter and the result is natural. The photos were taken approximately 1 month after surgery, so he is still very swollen. On the profile view, he has reduced the noticeable hump on the dorsum of his nose, yet has maintained a masculine appearance. This gives you an idea of what you might look like at this stage of healing. This patient also had the width of her nose decreased and obtained better definition of her tip. In the bottom photos, you can see the hump on the dorsum was smoothed out and the tip was rotated up slightly. These subtle changes are often all it takes to provide a natural result and improve one's appearance. This is another before and after photo of a patient who has had a rhinoplasty or nasal reshaping procedure performed. These pictures were taken 1 month after her surgery, so there is still a tremendous amount of swelling. On the front view, the nose looks much straighter. It is important to note that even though the nose looks straight at this point, healing and the contraction of scar tissue as well as trauma can cause the nose to be crooked again. On the oblique and side views, you can see that the contours of the nose have been dramatically improved, specifically along the dorsum and tip. Again, at 1 month after surgery, there is substantial swelling and the nose will change over the next year. This patient requested a smaller, straighter nose with a ski slope type turned up tip. She was happy with the improvement she obtained at this stage of healing. Some patients request a nose and a tip with this type of slope, while others do not want this. It is very important that you communicate with your surgeon the degree of changes that you are looking for to make yourself happy. These are before and 6 month after photos of a patient who had a rhinoplasty. She wanted a natural-looking nose with minimal changes. She wanted the dorsal bump removed as well as bringing up her tip as she felt it was plunging too low. Although her tip was rotated up slightly, just reducing the bump on the top of the nose gives the illusion that the tip is rotated up. Again, it is important to communicate with your surgeon clearly the desired changes you would like to make. Her nose will continue to change and contract over time. This patient wanted a subtle change and natural result from her rhinoplasty. It is most evident on the oblique and side views as her hump was slightly reduced. Often, just these subtle changes make a big difference. These are before and 8 month after photos of a patient who had a conservative rhinoplasty performed. The dorsum and tip were reduced and the nose was slightly shortened and rotated up. Particularly on the oblique and profile view, the removal of the bump on her dorsum has allowed the observer to focus more on her eyes. This patient had a rhinoplasty performed with the after photos taken 9 months after her procedure. She wanted to reduce the width of her nose, make her tip more defined, and also reduce the small bump on her profile view. Because the skin on her nose is thick, it will limit the definition she would ultimately like to achieve in her tip. The skin envelope will continue to tighten down over time. These are before and 10 month after photos of a patient who had a rhinoplasty performed along with a facelift, brow lift, and eyelid surgery. The changes in her nose are subtle, but on the front view her tip is less boxy, her nose thinner, and on the profile view her hump has been smoothed out. These close-up photos make it easier to focus on the changes in the nose. These are before and 1 year after photos of a patient who had a rhinoplasty performed. She wanted to have her nose straightened and the dorsal bump reduced. She has very pretty eyes and felt that the appearance of her nose was distracting and taking away from her eyes. These are before and approximately 1 year after photos of a patient who had a rhinoplasty and chin augmentation performed, as well as open neck contouring, brow lift, and blepharoplasty. He wanted to reduce the hump, straighten his nose, and maintain a masculine appearance. Comparison to post-operative views shows a very nice subtle change. I feel it is usually a much wiser choice to be conservative with surgical changes in order to maintain a natural appearance. This is an even more critical issue with men who will not be happy with a feminine look. These close-up nose photos make it easier to see the changes in the nose. This patient had a reduction rhinoplasty performed with the after pictures taken 1.5 years after her procedure. Again, I feel this is a classic example of her beautiful eyes being lost because of the distraction of the excessive projection of her nose. After this element is reduced in a natural way, her eyes stand out much more. These are before and 16-month after photos of a patient who had a rhinoplasty, chin augmentation, and submental liposuction performed. In addition, she had brow lift, eyelid surgery, and fat removed from her cheeks. The nose and chin are critical determinants of one's profile in creating balance and proportion. She wanted to straighten her nose, remove the bump on the dorsum, and improve the position and shape of the tip. She also wanted to achieve more balance in her face and, most importantly, look natural. These close-up nose photos make it easier to see the changes in the nose. Patients often want to know what they will look like early on in the healing process and how presentable they will be. Obviously, the amount of swelling varies with patients, doctors, and the procedures performed. This patient, as noted previously, had 7 different procedures performed on her face, so she is very swollen. If you try to concentrate on the nose itself, you can see the degree of swelling during the first 5 weeks. This picture was taken 1 week after surgery, after the nasal splint was removed. These photographs show her at 2 weeks and 5 weeks after surgery. Although definitely swollen, she felt comfortable in public, and makeup can usually cover bruises at this time. This is a patient who had a rhinoplasty performed as well as her buccal fat removed from her cheeks. On the front view, you can see that the nose is more narrow and defined in the after pictures, which were taken 6 years after her procedure. The tip looks natural and has better projection, position, and definition than previously.
To understand how rhinoplasties are performed, it is important to have a basic understanding of the anatomy of the nose. In the most simplistic terms, the nose is composed of skin, bone, and cartilage. The graphic here shows the orientation of those structural parts. From the side view, the nose can be divided into the dorsum, the tip, and the nostrils. Bone and cartilage make up the dorsum, while the tip is all cartilage. In this graphic, the skin has been totally removed to show the underlying anatomy. The hard part of the nose near the eyes is bone. The middle, more flexible portion of the nose is cartilage, commonly called the upper lateral cartilages. If you feel your own nose, you can actually feel where the bone ends and the softer cartilage begins. The tip of the nose is also made of cartilage, commonly called the lower lateral or alar cartilages. Obviously, all noses do not look the same. That is because the size, shape, position, and relative proportion of these bony and cartilage parts of the nose are variable either from birth, trauma, or surgical change. The thickness of the skin covering the nose is also very different from patient to patient.
These variations in shape, size, and proportion of bone and cartilage, as well as varying thickness of skin on the nose, provide the basis for noses looking very different. Your plastic surgeon will have to diagnose and decide which anatomical parts are responsible for the visible features you do not like. Your surgeon will also have to design and execute a surgical plan which will modify these anatomical features safely. These bony and cartilaginous parts of your nose under the skin provide a unique shape, but they also provide support and structure. Changes in their size, shape, and position have to be done without losing support and causing instability of your nose. Alterations that cause loss of support or instability can result in problems such as unappealing visible appearance and difficulty breathing, among others.
During your consultation with your plastic surgeon, it is essential that you and your surgeon communicate very well to improve your chances of a good outcome. You need to know and express exactly what it is that bothers you about the appearance of your nose, not that it just doesn't look good. Your surgeon should be able to point out the underlying source for the problems that you're unhappy with and give you a reasonable idea of the chance of improvement based on your unique tissue qualities. Many patients will bring in photos of noses that they like. It is unlikely that your surgeon can make your nose look like someone else's. It is important, however, to convey to your surgeon what it is about the noses that you do or don't like. Although you should listen carefully to your surgeon's suggestions and opinions, it is you that must ultimately be happy with the plan and results. If you are certain that what your surgeon is suggesting will not make you happy, it may be wise to further delay your operation and consult with another surgeon. Your surgeon, however, may have valid medical concerns which limit the ability to alter your nose in the manner you desire. Prior to scheduling, however, you must both be in total agreement with the plan. The computer imager may be valuable for that reason. It is an excellent communication tool. It is important for you to know, however, that it is just a communication tool. Anticipated results and goals can be drawn on the computer, but that is just a simulation. Although final results often end up looking just like the simulation drawing, often they do not. The value of the computer imaging is that your surgeon and you can explore possibilities and at least decide on what you would or would not prefer. This tool ultimately may provide a clearer picture or plan of what change should or should not be made. It may also convince you that no change should be attempted at all. The computer picture should by no means represent a promise or guarantee of results expected. To generalize very simply, most surgical changes are accomplished by removing or adding cartilage or bone or changing their orientation. If the dorsum is too high, it can be reduced by rasping down or removing bone and cartilage, as is shown in this graphic. If the dorsum is too low, it can be raised by the addition of bone, cartilage, or even synthetic materials, as shown here. Changes in the shape, volume, projection, and position of the tip of the nose can be accomplished by removing cartilage or adding cartilage. These changes can affect the profile and front view of your nose. The graphic on the left shows cartilage being removed to make the tip smaller. On the right, cartilage is added to change the shape or projection of the tip. By carefully breaking the bones of the nose in a controlled fashion, the width of the nose can also be changed. The nostril size and the fleshy portion around the nostrils can also be reduced. This will require an incision on the outside of the nose, which usually leaves a scar in the location noted on the right. It is usually difficult to see. Do not expect the shape and size of your nostrils to be exactly the same afterwards. They are often different before surgery anyway, if you closely scrutinize them. Many techniques and maneuvers can be utilized by surgeons to change the appearance of your nose,